peace must be our goal and our guide. And all that we strive for as a human family, dignity and hope, progress and prosperity, depends on peace. But peace depends on us.
Seven tips for protecting yourself against the coronavirus. 1. Wash your hands regularly with soap and water or with an alcohol-based gel. 2. Need to cough or sneeze? Do it into a tissue or a bent elbow and then wash your hands. 3. Stay at least a meter away from other people, especially if they are coughing, sneezing, or have a fever. 4. Avoid touching your eyes, nose, and mouth. 5. Avoid direct contact with live animals. If this is impossible, make sure to clean your hands afterwards. 6. Do not eat raw or poorly cooked animal products and wash your hands, clean surfaces, and utensils afterwards. 7. If you develop a fever, cough, or difficulty in breathing, seek medical care.
I'm joining the World Health Organization's Safe Hands Challenge. Hand washing is one of the most effective ways of preventing the spread of coronavirus. Wash your hands with soap and water for at least 40 to 60 seconds.
In the entire world, health, safety, preparedness of disaster are key issues in any working environment. The safety regulations of any institution or infrastructure in the world are paramount to a successful economy. We have health and safety regulations in industries, in hospitals, in schools. But what baffles us, and what baffles most of us, is that these regulations are not followed. For example, putting up a school in Kenya, you need to go through several methods before you are approved to have the children, including the capability of you housing 800 school children who were actually part of this school that collapsed by itself. But what does this teach us? Teaches us that there are areas in this country that need help. One of those is that area where the school was built, just near petrol stations, near the roads, blocking everything, no sewage, no escape routes. This is the tragedy of Africa we have. In most African countries, people don't follow health and safety regulations. Most countries have no disaster preparedness mechanisms. Africa is reactive instead of being proactive. What has led us to this? Why are we behaving in a manner that we don't see? What is the building? What does it look like? Are there cracks in the building? I believe The parents were taking children to this school. At this hour, they should reflect. And most of the parents in this country should also look at the schools and institutions where they leave their children. Some of the schools are inhabitable. Conditions are very dangerous. There's a school somewhere in Kajiado which has been condemned near the railway, and still children use it. So are we ourselves to blame for all these disasters that come to us? Whoever is the owner of this school was aware that this school will come down. Use your conscience to decide as to whether you are doing the right thing. If you are spitting on the road, if you are throwing, dirt on the road, if you are breaking things on the road, stealing the lamps, lights, stealing the signposts on the road, think of the other people who would need them, and then always be on alert to alert the authorities of what you have seen, what is in the place, because that would help. To you, you might think it's a smaller thing, but it's a very good thing for Africa. Do we have health and safety regulations in Africa, in our offices? How many of you know your health and your safety and health regulations? How many of you practice it? How many of you put buildings in exit routes? How many of you put everything in exit routes? Your bags, your what, your sticks. Remember, when the fire catches, you need this route. So get away from it. Take care. Thank you. Good evening, viewers. Welcome to Punchline Africa Television, broadcasting from the command center of the political division of Punchline Africa Television. Wherever you are in the world, thank you very much for watching us this evening in Nairobi, and wherever you are in Cairo, in Libya, Tripoli, the whole world, in Wahoo, in Hebei district or province of China. Thank you very much. Congratulations wherever you are. Thank you very much for the Chinese doctor for having worked so hard. Thank you very much, viewers, and the rest of Africa for keeping us informed. We want to thank the government of the Republic of Kenya for keeping us informed on various institutions that are conducting, working day out, day in, to make sure that the virus does not spread beyond what it is today. Viewers, this evening is a very simple topic: security. This is a show that touches security of the continent, of the world, and wherever you are. We know we are under the coronavirus, COVID-19. But as much as we are under COVID-19, we must be very careful not to forget international security obligations. We have international security obligations. I can see so many TVs in Kenya, in the world, forgetting the most important key element of our humanity and society, and our society and the social status is security. As much as we look at the end of the disease that has touched everybody. Almost everybody in the world is touched. We must also look at the other side of security. What security do you have in your country? What are security agencies doing to make sure that Al-Qaeda, Al-Shabaab, other agencies, ISIS, don't take this opportunity to enter and disrupt the peace that we have? That's why today, from here, the command center of our broadcast, which is a satellite system, via the satellite system, we are talking about security. And anybody who has ideas, wherever you are, whether you are in Malaba, I can see so many people in Malaba, Uganda border. I can see you coming up on the line. We can see so many people from Germany coming up, so many people from United Kingdom. Thank you very much. Wherever you are, think about the security of East Africa, the security of your country, where you are in South Africa, in Zimbabwe, in Uganda, in Somalia itself. This is the moment that we must reflect and look back and see, make sure that we change the tactics. We make sure that our security improves. We help the police. We help the security agencies. Don't sleep on the job because there is Corona 19. Coronavirus can be there, but security is very important equally. If you don't have your security, you might not be able to be treated in a hospital. So the pandemic could affect the security situation. It has affected the diplomatic relations. We are looking at each and every aspect. Security comes in several angles. Cooperation between America and China. Is it there? Cooperation between the fighting forces in any part of the world, wherever they are. Cooperation in Mali, where Al-Qaeda is, and ISIS. Cooperation in Syria. Cooperation in Iraq, Afghanistan. If you sleep and we walk about and talk much about only the coronavirus, elements of terrorism could strike us without knowing. So we brought this topic to alert other media agencies in the region, in Kenya, to start talking about security of this country during this time when we have this coronavirus. You should not only think of coronavirus. Let's also think about security. Let's also think about what people can take advantage. To think there is no place you can only walk and drive in and do what you want to do. We should not slacken our security operations. We should not be lax, sit and say we have the diseases there, therefore no wizard will come to be a wizard. Terrorists are terrorists. Terrorists do their job, their bad job at any time. Terrorists time at different situations like this, where there is lack of cooperation between agencies, among agencies. Information sharing is not coming from China or Russia to the United States or from Britain. Each country is, or from France, or sharing of adversary notes to say there might be terrorists striking here. We are not having those coming. And we must alert our common people, the citizens, to be on alert as much as we are on alert on coronavirus. We need to be on alert, on a very serious alert on the same subject. We must be alert on the security. We must find out, keep our borders. Some countries have closed their borders. There's no aircraft coming. This is the time that people can start coming. This is the time when terrorists could strike us. We have to be careful. We are vulnerable to any disease. We are vulnerable to security, insecurity that could come with disease. We are seated inside the houses. Nobody is maybe walking in the town. The town is empty. Terrorists can take over and do whatever they want to do. So we must stand up, wake up, start talking about the security situation. Many are families who were already food, there's food insecurity is going to come. The rationing of food can cause insecurity. The lack of food can also cause insecurity because people will start stealing from other people. That is already an insecurity issue. They can be there. You know, everybody was running to buy sanitizers. Now sanitizers are nowhere to be seen. And those who don't have will have to go and do something to get it. We should call upon citizens to keep quiet, to be calm and wait. The sanitizers will come. In absence of the sanitizer, use water. No more water and soap. That can also create insecurity. So far, with the world, as you see the dots, Africa, we have been very lucky in some aspects. But with the conditions that are coming and the days that are coming ahead, we don't know what might happen. Therefore, we must work hard to help security agencies, to talk to the security agencies, to give information, however bad the information is. You know, there is now the sense of fear of saying, how will I go to the police station? How will I go and report an incident? Because you will be touching the door or the counter, or you will be sitting. This is all it comes to with security. So I see so many televisions in Kenya are not focusing on that aspect. So I have opened, as a man, as usual, who studied this subject internationally, I always open up for other people to follow. I would like to see the mainstream television stations talking about the security during this time, talking about our borders, talking about our schools. We have left schools, we have abruptly, everybody fears to touch something. Are the watchmen at schools looking after our property? That is also another question. Will people take advantage to steal property? Will people cause insecurity? These are the questions. Food and the financial donations from corporations have sharply decreased. Even as the logistics of safety of feeding the hungry have become more complex, volunteers at food banks, food pantries, soup kitchen, and so on and so forth. Volunteers of food, they are there. In other countries like Britain, people have, put up volunteer points. Volunteer points are to give the vulnerable, the poor, those who need something, those who have not eaten. Have we done it in Kenya? Have you done it in Uganda? Have you done it in South Africa? Have you done it in Egypt? These are cardinal questions that we must ask. And if the government have not put in that mechanism of security, the concern about economic consequences of the pandemic spurred another widespread decline of stock exchanges, stock prices, with industrial average of almost everything wiped out. These are fundamental things that are going to affect those who used to trade will lose, those who are trading have lost, those who have nothing remain with nothing. So what happens? As you see from the several videos in America, people have resorted to buying guns. Why is it that Americans started buying guns? When they said there will be a lockdown, Americans have decided to buy guns instead of buying or trying to help other third world countries. Americans have descended on the shops to purchase guns. And these are some of the things that are happening to the international community. The lack of facilities, the masks, the lack of masks, they lack little manpower, small manpower, manning institutions, police not enough, driving could be a problem, accidents It will take time for ambulances to come. Worldwide, what about in Kenya? Are we prepared? These are some of the things that I wanted to open up the subject. And other television stations, I always lead, they will follow. And they can come and pick from me, take this subject and start talking about it. We shall have it tomorrow in the daytime and discuss. But this evening, the frontline security program, how people are prepared. In these circumstances, how many people are prepared to help neighbors, to help the police, to help institutions that gather information. Kenya is a frontline state near Al-Shabaab. We are near Al-Shabaab, near the border with Somalia. We expect anything to happen, God forbid. We must be on alert, on standby. Any information that you have, put it before any officer or call the lines that are available. Don't take it lightly. This is the moment when security of international nature is concerned. Yesterday at night, I did a program about the relationship between America and China. Viewers, it was a very, very interesting relationship. That all this started in Wahoo, which is the province who won, the province that started the whole thing of coronavirus. The virus started there. The question that lingers in the minds of so many people, why did America tell its people to go away? The question that remains unanswered. First, they told the families to leave of non-essential people. Second, they said the whole family. These things started early in November. And as we Africans watched, we sat, I was watching the trend, the international trend. That's why I wrote that letter on 18th of February to warn my African people. To warn them there is something on international intelligence that is warning that there is a problem coming. We did not see it. That's why military governments, most of them, look at the country like Uganda, for example. Museveni, who is very keen at following what Matanga does, all over the whole world, wherever it is. He was keen to close the border. He closed the border. He closed. Museveni literally has closed the country. No bus is going in, no bus is coming out. No airplane is coming in. If you come in, you have to be sprayed. There was an international intelligence network that was flowing. I started picking it earlier in November. What was going on? As a security-minded person, I saw there was some danger. What was this? That America removed all its people. When America gives you a warning advisory, an advisory note that there will be this happening, Trump moved all Americans out of China. Trump decided to move all, even the families, to leave Bucket and go back home. That would give you a signal that something very serious was coming. Therefore, now in this security program, we still continue to advise. It is not yet over. We thank the Minister of Health in Kenya, wherever you are. You have done very well, Mr. Kagwe. Mutahi Kagwe, I saw you in 2004. I saw that the eyes, the generation. You are younger than me, but I saw something in it. Slightly younger, maybe 2-3 years low. But I saw when I came to your office in 2004 to seek an interview in Sky News to interview President Kibaki. You looked at my face and I said, are you the boss of these 6 white Sky News guys? It was a joke you made. And I said, yes, I'm the boss, I'm the the consultant for Africa for Sky News, and these are my crew. He said, you have got the interview. I got it. Mutahi Kagwe is a hardworking person. And we thank President Uhuru Kenyatta for having appointed him, that he has lessened the hiccups. You can see, tuko na shida, lakini people are happy. For non-English Swahili listeners, we have problems, but the problems, you can solve them happy when you are happy, because the minister is confident of what he's saying. Had there been some ministers like a Kiyunjuri, we would have had a problem. Kiyunjuri would tell us the rockcast is upstairs, the rockcast is downstairs, the rockcast, take a picture. Mr. Mutahi Kagwe is not saying take pictures. He said take it, fill the form. If you fail, we arrest you. If you don't fill the form at the airport when you enter, you create insecurity for us. They will arrest you. We shall follow you and get you. Declare yourself. Put yourself before the medical people so that you can be treated and get cured. This disease has affected almost everybody in the world. There is no family in the world that has not been affected. There is no family in the world that has no person coughing. Several people. The signs might not be there. They said it takes 14 days. We don't know. So many things. That's why this evening I saw a note from President Mnangagwa of Zimbabwe signing seriously that the schools will close next week on 24th, Tuesday. All the schools will be closed. Both primary and tertiary schools, universities will close in Zimbabwe. Remember, Zimbabwe took several measures. And as we stand now, it has not received any occurrence of any victim or any sick person from the disease of COVID-19. Uganda also has not yet, our neighbors across from Kenya, Uganda has not received any of these diseases. But it doesn't mean that it is over. There is no relaxation in Uganda. Museveni has taken it a notch higher to make sure that there is no relaxation. He has closed all the border points, as I have told you, and they are spraying everybody, they are measuring everybody. And they are asking people not to just do the torch, but stand there for a few minutes, because some of these torches deceive, then you go, the temperature is high. People are being told stand there for even about almost 45 seconds to see whether the temperature is stable, then you can go. Conditions have been put in place. We have put all contingency measures. We want to thank the people who have been working day and night to make us very, very safe. In most countries in the world, around the world, the days and the restrictions have come into place. In London, this afternoon, this evening, they are closing part of the London Underground. I am on call from my home of where my family and my rest of my children and the rest of the grandchildren are, and I am having telephone calls from there on how the situation is in London. We have a few facilities. Most of the good thing with the London people is facilities have been opened, ambulances are working, everything is visible, police is available on the streets to help on the security approach. This is what we say everybody in the world should help. Even in Kenya, the police are on standby to help you. Don't see any crime being committed and say we did not see. They are waiting for you. They want you to be there so that they help you. China created the impression, and it has brought the impression that this is a crisis similar to SARS. You remember SARS came up in Hong Kong. It killed so many people, giving the rest of the reason to the world to the reason to reduce dependence on China for growth of production. Oil prices are going to go up, have fallen by 20%. We shall be affected. It is insecurity. Many cars, many factories, many buildings that use oil for lighting and other things, there will be insecurity. Side effects of coronavirus pandemic are sure to include widespread economic hardships and uncertainty, which can lead to conflicts. And you know very well that is always what happens when there is a shortage or shortages of any nature. There is no doubt, therefore, that coronavirus pandemic marks the moment when recession happened in decline in GDP. That lasts more than few months. It could happen, the GDP could not be the same. Airlines are going to lose. Travel has been frustrated. There is no tourism coming in. Kenya is losing 200 billion, 2,000 billion, could the whole world, the possible cut of 800,000 jobs. Those who work in hotels. And as you know, most of the hotels everywhere, not only here, there is nobody who wants to go to the hotel. Everybody is running away from the hotel to go back to other places. The job losses will ripple out everything. The newly unemployed would use it all back. The music businesses could lose billions of dollars. Disruption in one nation becomes disruption business in another country. I think all of you who are watching me will agree that we have a problem here where disruption in one country leads to disruption in another country. If Uganda is not allowing people to come to Kenya, or if Kenya is not allowing people to go over to Uganda, that disruption can cause insecurity. And then, for example, Hyundai stopped making cars in South Korea because they can't get components in China. On and on. It goes on until it adds up to a loss of almost 1.5 trillion. Just the world stock markets crumbled. It could cost the world economy almost 2.7 trillion by the time we don't know when we shall wake up from the coronavirus. The index, as you can see on the map that I'm sharing, all these things bring insecurity. There's nothing you can say if the trading is so bad, insecurity will not occur. It will occur. And that is exactly the truth that we must talk about. Similarly, we are witnessing the unavoidable side effects of social distancing. The reduced economy. If you have social distancing, how are we going to work? What about in the house? What do you do to your children? How are we going to measure this? This causes all these difficulties that are part and parcel of us, which we must go through, which we must adhere to. The social distancing is very important, and you must adhere to it. Don't go there and shake hands. Don't do things that's why every football team, every cinema, every nightclub, every meeting, church services, even in Rome, the Pope has cancelled. We are just having a satellite link with Vatican on Sunday. And in Canterbury, the bishops have stopped. Some people will stay at home and pray from their houses. This is something which is not a joke. Campuses have closed, colleges have closed. Everything has come to a halt. This is Frontline Africa Television. Viewers, as we come to the end of our show, we promise we shall do only 30 minutes because this is an improvised system from the political command center, an improvised system of, they are talking of 6 feet away from each other. I don't know. What about if you have a wife in the house? What do we do? Child in the house, your child, what do you do? These are the inconveniences that we must undertake. If your child is sick and you are not sick, you leave him 6 feet away. Some of the children are young. What do? You must do something. Keep it the spirit. Agree with the directions that have been given by our people who are experts. Please don't break the laws. Don't become violent. Be careful. Be on the lookout. The direct impact of coronavirus is a wide quarantine policy that compels multiple organizations to allow their workforce to work from homes in order to maintain business continuity. This inevitably entails shifting a significant portion of workload to be carried remotely, introducing exploitable opportunity for the attackers. You see, we could be attacked. You are working at home and you need resources. This is some of the security. Look at that. You are working in your house and the people know that you are manufacturing some things in the house, or you are the director, or you are being given some money. Keep it safe. And that is what we wanted to introduce, a topic that can be picked up by any television station in Kenya to discuss the security impact, the impact on security internationally. Diplomats, countries are broken. I don't think China is talking to America. Neither America is talking to China. In doing so, we have lost out the component of discussion on what can be done about this scourge, or what can be done about security and terrorism. So you can see what it is. And I want to thank you all. Let me read some of the messages of the people who have been contributing to the debate today. And I want to thank you all of you who have been contributing to the debate. I want to make sure that all of you have got the message, and that message has sunk home. And let me go straight to the messages. I want to thank you for making your time. We know everybody is running back to their houses, but there are few people who said they are not going to keep quiet, but they will. I want to thank Mwangi Anthony Salongo from Ruai. Is it Ruai near Thika? Thank you. Emmanuel Origimas Mouth from, whenever you talk, tell us where you are calling from. I believe from Nigeria. You guys are doing a great job. Bomb against Biafra at Lagos in Nigeria. There is a bomb. I don't know. Thank you very much for that information. We shall look it out. Watching with interest and appreciation from Zimbabwe, Martin Mutimutema from Zimbabwe. Thank you very much. Christo Mendoza, people dying over in your countries from coronavirus. Never can trust the media, especially from our open enemies. Yes, that the open enemies of Africa are well known, and we know them. The CNN is now focusing. If you look at the BBC, they are causing more insecurity on Africa, everybody is focusing on Africa. Instead of telling us what is happening in London, they are telling us what is happening in Africa. I was listening to the program this morning, and Henry Come, greetings, doctor. Thank you very much, Henry, my great friend. You got lost, but I'm still around and available for any consultation. And then Dafuli Chidune Vincent from Nigeria. Thank you very much, Dr. David Matsanga and Miriam. Miriam is not here, but she's watching also. Henry Comey is watching from Maryland in America. Christo Mendoza is watching from Zimbabwe. Peace to all. Christo Mendoza said, we need our own Black scientists, doctors, nurses, laboratories, natural medicine healers, herbalists, schools and educational systems that are Afrocentric and more to will cure these diseases. So many people are coming up with ideas. We welcome Wuhan is now free, and it is free from everything that caused the disease. Viewers, we want to thank you very much. Tune in again tomorrow at 11 o'clock East African time, when we shall have Good Morning Africa. We shall review the situation then. From me in the political command center of Punchline Africa Television. Thank you very much. That is our security. Security, the most important key thing that this program has brought out is don't forget your security. Don't forget that as we go through this sickness, there is bound to be some people who will take advantage to compromise our security. So don't forget that. Don't overlook such things. Thank you very much. God bless you. This station, therefore, is for Africa, with Africa, by Africa. Ciao.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water, or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.